Good afternoon, bon l'après-midi à tous.
Good afternoon, everyone.
On the national epidemiology and the modeling work that we're using to inform ongoing control of COVID-19 in Canada. But first, I'll begin by providing the latest numbers on COVID-19 in Canada. There have been 103,250 cases reported in Canada to date, including 8,522 deaths, and 64% of those with COVID-19 have now recovered. Labs across Canada have tested over 2,676,000 people for COVID-19 to date. And over the past week, an average of 36,767 people were tested daily, with 1% testing positive. These numbers do change quickly, and they are updated daily in the evenings on canada.ca/coronavirus.
Bonjour. Je fais aujourd'hui.
Hello. Today I'll be sharing an update on the national epidemiology and the modeling work we are using to inform ongoing control of COVID-19 in Canada. But first, I'll be reported in Canada to date, including 8,522 deaths, 64% of the 1,000 people for COVID-19 to date. Over the past week, an average of 36,767 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus.
I'll begin with an update on the latest epidemiology in slide 3. Although most health regions in Canada have reported cases, this map showing the incidence rate per 100,000 population illustrates that some areas have experienced more activity than others. In particular, Quebec and Ontario jurisdictions account for 86% of our cases overall. Currently, hotspots linger with persistent community transmission in and around Toronto and Montreal. So in looking at the boxes to the right, the lower box shows that the proportion of cases who died has remained at about 8%. This case fatality ratio changes over time as new cases and deaths are reported. Based on the available information, 15% of cases have required hospitalization and just over 3% have required intensive care.
Je vais maintenant faire le point sur les derniers données.
I'll begin with an update on the latest epidemiology of COVID-19 across Canada. Slide 3. Although most health regions in Canada have reported cases of COVID-19, this map showing incidence rates per 100,000 people illustrates that some jurisdictions and regions within have experienced more activity than others. In particular, Quebec and Ontario have had some heavily affected areas, and considering their larger populations, these jurisdictions account for 86% of cases overall. Currently, hotspots linger with persistent community transmission in and around Toronto and Montreal. If we look at the boxes to the right and the lower boxes regarding deaths, the proportion of cases, this case fatality ratio changes over time as new cases and deaths are reported. Based on available information, 15% of cases have required hospitalization and just over 3% have required intensive care.
Slide 4. These graphs showing that daily numbers of new cases and deaths on top and the daily totals of hospitalized and critical case patients on the bottom. They all illustrate the steady decline in COVID-19 activity since the peak of the epidemic in late April. Monitoring these indicators tell us that our public health measures have been successful in slowing the transmission in the community, particularly as all four show a steady decline.
Maintenant, la diapositive 4.
Now for slide 4. The graphs showing daily numbers of new cases and deaths on the top and daily totals of hospitalized and critical case patients on the bottom illustrate the steady decline in COVID-19 activity since the peak of the epidemic in late April. Monitoring these indicators tells us that our public health measures have been successful in slowing the transmission of COVID-19 in the community, particularly as all four show a steady decline.
Slide 5. Another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, each new case infects less than one other person. Nationally, the RT for Canada has been below 1 for more than 8 weeks. At this point, with transmission under control in jurisdictions across the country, fluctuations in RT at the national level, which you see in the sort of green shading if you have the graphs in front of you, are now a result of smaller numbers and localized outbreaks.
Diapositive 5. Une autre
Slide 5. Another indicator of epidemic control is the effective reproduction number, or RT. This number represents how many people are infected by each new case. In order for the epidemic to die out, RT needs to remain consistently below 1, meaning on average, which is good news. At this point, with transmission under control in jurisdictions across the country, fluctuations in RT at the national level are now a result of smaller numbers and localized outbreaks.
Okay.
Slide 6. So all age groups have been affected by this pandemic, although incidence among children and youth has remained relatively low throughout. On the left, the sharp peak in incidence among adults aged 80 years and older, which is the green line, is largely attributed to outbreaks in long-term care homes. As the epidemic has slowed, the incidence rates have steadily declined in all age groups, though the decline has been relatively slower in younger age groups. Because transmission rates are declining so steeply in the oldest age groups, individuals under the age of 40 now account for a greater proportion of total cases in recent weeks.
Diapositive 6.
Slide 6. All age groups have been affected, although incidence among children and youth has remained relatively low throughout. On the left, the sharp peak in incidence among adults aged 80 years and older, the green line, is largely attributed to outbreaks in long-term care homes. As the epidemic has slowed, incidence rates have steadily declined in all age groups, though the decline has been relatively slower in younger age groups. Because transmission rates are declining so steeply in the oldest age groups, individuals under the age of 40 now account for a greater proportion of total cases in recent weeks.
Slide 7. The epidemiology of COVID-19 in Canada is a composite of different regional epidemics. This slide shows Canada's 3 largest outbreaks across the top. All have experienced significant community spread and daily cases into the hundreds, especially in Quebec and Ontario, and to a lesser extent, Alberta. The center row shows provinces with outbreaks and limited community transmission, with daily case counts remaining below 100, and transmission now largely brought under control. The lower row with daily case counts in the low double digits show provinces that experience isolated and largely contained outbreaks with minimal to no community transmission. Finally, the multiple distinct peaks in the curves along the right-hand side for Alberta, Saskatchewan, and New Brunswick serves as reminders that resurgence can happen in any place and at any time, even in areas with no or low levels of transmission. Prince Edward Island, the Yukon, and Northwest Territories have had no community transmission, while Nunavut had reported no cases to date.
Diapositive 7.
Slide 7. The epidemiology of COVID-19 in Canada is a composite of different regional epidemics. The slide shows Canada's 3 largest outbreaks across the top, all having experienced significant community spread and daily cases into the hundreds, especially in Quebec and Ontario, and to a lesser extent, Alberta. The center row shows provinces with outbreaks and limited community transmission, with daily case counts remaining below 100, and transmission now largely brought under control. The lower row, with daily case counts in the low double digits, shows provinces that experience isolated and largely contained outbreaks with minimal to no community transmission. Finally, the multiple distinct peaks in the curves along the right-hand side for Alberta, Saskatchewan, and New Brunswick serve as reminders that resurgence can happen in any place at any time, even in areas with no or low levels of transmission. Prince Edward Island, the Yukon, and the Northwest Territories have had no community transmission, while Nunavut had reported no cases to date.
Current patterns of COVID-19 incidents, and this is in the past 14 days, show limited to no transmission in most areas of the country. But areas of increased incidence, shown as darker blue areas on the map, represent areas experiencing outbreaks, as seen in areas of Saskatchewan, and hotspots of persistent community transmission seen in and around Toronto and Montreal.
Diapositive 8. Étant
Of increased incidence, shown as darker blue areas on the map, represent areas experiencing outbreaks as seen in Saskatchewan, and hotspots of persistent community transmission as seen in around Toronto and Montreal.
To add that you can see also the Windsor-Essex area lighting up at the moment as well. So the next slide, slide 9. COVID-19 has exploited social and economic vulnerabilities and inequalities across Canadian society, taking hold in settings and among communities that experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with over 1,000 separate outbreaks, accounting for about 20% of confirmed cases and tragically over 80% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include hospitals, correctional facilities, shelters, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
Diapositive 9.
Slide 9. COVID-19 has exploited social and economic vulnerabilities and inequalities across the Canadian society. It has taken hold in settings and among communities that experience overcrowding, lower incomes, and health disparities. Long-term care and assisted living homes have been hit the hardest, with over 1,000 separate outbreaks accounting for about 20% of confirmed cases and tragically over 80% of all deaths. Outbreaks in other congregate living and work settings are also driving case counts in some provinces. These settings include hospitals, correctional facilities, shelters, and workplaces, including Canada's largest outbreak linked to a meat processing plant.
I just want to point out also on this slide, we're looking at sort of more recent outbreaks of clusters, and these as society begin to reopen again, and these do include funerals and indoor family gatherings. Slide 10. So really, in summary, the epidemiology is that cases can reemerge anytime or place. In today's modeling update, I'll talk about how we are using modeling to identify the combinations and intensity of public health measures we need to maintain control, stamp out outbreaks, and prevent a widespread resurgence of cases. Models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions towards a best possible outcome.
Diapositive 10.
Slide 10. In summary, the epidemiology indicates that transmission is largely under control in Canada, while also showing us that cases can reemerge at any time in any place. In today's modeling update, I'll talk about how we are using modeling to identify the combinations and intensity of public health measures that we need to maintain control, to stamp out outbreaks, and to prevent a widespread resurgence of cases. Models provide a prediction of what could happen under hypothetical scenarios, allowing us to drive our public health actions toward a best possible outcome.
Slide 11, just as a reminder, Canada is aiming for strong epidemic control over the course of the pandemic, with less than 10% of the population infected overall. And thanks to the commitment of all Canadians who have been following public health advice to protect themselves and others, we are well on our way down the right side of the big first peak. Unfortunately, the novel coronavirus has not been eliminated, and we do not have an effective vaccine at this time. So as restrictive public health measures are being lifted to minimize the unintended health, social, and economic consequences, we expect to see some resurgence of cases. The key is to keep the number of cases small through ongoing core public health practices. We must be able to rapidly detect and isolate cases and quarantine their contacts in order to keep any resurgence to a small and manageable size.
Diapositive 11. Le Canada.
Slide 11. Canada has been aiming for strong epidemic control over all Canadians who have been following public health advice to protect themselves and others. We are well on our way down the right side of the big first peak. Unfortunately, the novel coronavirus has not been eliminated, and we do not have an effective vaccine at this time. As restrictive public health measures are being lifted to minimize the unintended health, social, and economic consequences, we expect to see a resurgence of cases. The key is to keep the number of cases small enough through ongoing core public health practices.
Dynamic models are telling us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility. Modeling simulations show us that as we lift stay-at-home policies and business and school closures, we must strengthen other public health measures to maintain epidemic control. The enhanced public health measures include rapid case detection, testing, and timely contact tracing and quarantine to prevent new introductions and control any new chains of transmission in outbreak or community settings.
Diapositive 12.
Slide 12. These dynamic models all tell us that if we relax too much or too soon, the epidemic will most likely rebound with explosive growth as a distinct possibility. Modeling simulations show us that as we lift stay-at-home policies and business and school closures, we must strengthen other public health measures to maintain epidemic control. The enhanced public health measures include rapid case detection and timely contact tracing and quarantine to prevent new introductions and to control any new chains of transmission in outbreak or community settings.
Slide 13. Fast and thorough case detection and contact tracing means that cases, including any contacts that go on to become cases, will be less likely to spread infection to others. So the higher proportion of cases that can be detected and isolated early in the course of their illness, the fewer people they are likely to infect and will be less likely to spread infection to others. Likewise, when most or all contacts are identified early and placed into quarantine, fewer are likely to spread infection to others if they do become ill. So these modeling simulations illustrate the impact of rapid case detection, which is the graph on the left, and contact tracing, the graph on the right, combined on epidemic control. The faster we are, the more we drive the percentage of the population infected down. So I'm going to take a very brave attempt at taking you through a couple of these graphs. So just remember, we're trying to aim for the bottom of that y-axis, the lower percentage of people infected. So the red dot on the model on the left shows that if we detect cases within 5 days of becoming infectious, we need to reach more than 50% of all cases and isolate them to keep the epidemic under control. So keeping that dot low. The model on the right shows that if we trace contacts within 2 days of their exposure, we need to reach more than 50% of all contacts and quarantine them to keep the epidemic under control.
Okay, diapositive 13.
Slide 13. Fast and thorough case detection and contact tracing means cases, including contacts that go on to become cases, will be less likely to spread infection to others. The higher the proportion of cases that can be detected and isolated early in the course of the illness, the fewer people will be likely to be infected. Likewise, when most or all contacts are identified early and placed into quarantine, fewer are likely to spread the infection to others if they do become ill. Rapid case detection, which is the graph on the left, and contact tracing, the graph on the right. So it illustrates the impact of rapid case detection combined on epidemic control. As an example, the red dot on the model on the left shows that if we detect cases within 5 days of becoming infectious, we need to reach more than 50% of all cases and isolate them to keep the epidemic under control. The model on the right shows that if we trace contacts within 2 days of their exposure, we need to reach more than 50% of all contacts and quarantine them to keep the epidemic under control.
Slide 14. So the graph on the left, focus on that for now. Canada has been testing more people over time, with a lower percentage of testing coming back positive, indicating that our surveillance is sensitive and casting the net wide to pick up cases. If we switch to the right-hand side of the slide, the shorter the time interval between onset of illness and lab specimen collection, the quicker cases are detected and isolated to prevent further spread. So the graph on the right shows that this time interval has decreased over time from more than 8 days to around 3 days currently.
Diapositive 14.
Slide 14. Canada has been testing more and more people over time, with a lower percentage of testing coming back positive. This indicates that our surveillance is sensitive and casting the net wide enough to pick up cases. The shorter the time interval between the onset of illness and lab specimen collection, the quicker cases are detected and isolated to prevent further spread. The graph on the right shows that this time interval has decreased over time from more than 8 days to around 3 days currently.
Slide 15. Public health authorities are monitoring the number of cases that cannot be linked to other cases as a measure of effective contact tracing, with the aim of keeping this number to a minimum. So on the graph, this is the red part. The more cases that are unlinked, that is to say we don't know how they were exposed, the harder it is to stop community spread. Lower daily case counts right now facilitates contact tracing to link cases and break chains of transmission.
Diapositive 15.
Slide 15. Public health authorities monitor the number of cases that cannot be linked to other cases as a measure of effective contact tracing, with the aim of keeping this number to a minimum. The more cases that are unlinked, i.e. we don't know how they were exposed, the harder it is to stop community spread. Lower daily case counts facilitates contact tracing.
Slide 16. As society reopens, the average number of people we meet each day will increase, and there will be additional places and situations where there is a higher risk of virus transmission. These tables show different combinations of case detection and contact tracing that can keep the epidemic under control. So the colored cell shows that will keep the epidemic under control. So the top table shows that with restrictive measures, school, university, workplace closure, for example, many different combinations can keep the epidemic under control. The lower tables show that with increasing numbers of contacts between the epidemic, so there are less of those colored cells. Therefore, as society reopens and public health restrictions are relaxed, it is even more important that Canadians continue with collective efforts to maintain physical distancing and good hygiene to keep COVID-19 under control. This ensures public health capacity is not overwhelmed and can use case detection and contact tracing to control the epidemic.
Diapositive 16.
Slide 16. As society reopens, the average number of people we meet each day will increase, and there will be additional places and situations where there is a higher risk of virus transmission. These tables show different combinations of case detection and contact tracing that can keep the epidemic under control. Colored cells show successful combinations according to 3 modeling studies. The top table shows that with restrictive measures, for example, school, university, and workplace closures, while many different combinations can keep the epidemic under control. The lower tables show that with increasing numbers of close contacts between individuals, it becomes increasingly difficult for public health to do case detection and contact tracing to control the epidemic. Therefore, as society reopens and public health restrictions are relaxed, it is even more important that Canadians continue with collective efforts to maintain physical distancing and good hygiene to keep COVID-19 under control. This ensures public health capacity is not overwhelmed and can use case detection and contact tracing to control the epidemic.
Slide 17. So Canada has made significant progress to bring the epidemic under control, thanks to the commitment of Canadians maintaining public health practices to protect themselves and others. Across the country, jurisdictions continue to increase social and economic activity with appropriate conditions and controls in place to minimize spread of the virus. Due to the progress that Canadians have made, we will be decreasing the number of media availabilities that we'll be holding each week for the time being. We will be providing updates in person twice a week over the coming weeks, unless there is something we need to urgently bring your attention to. We will also be issuing statements each day to keep you updated on the latest numbers and any news on the days that we're not holding immediate availability. So I want everyone to remember that the virus has not disappeared and resurgence can happen anytime or at any place. Until there is a vaccine or effective treatment, we need to continue to live with COVID-19 by balancing the risks of spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. So you should ask yourself, if you do test positive, consider that the fewer people that you have contact with, the quicker and easier it will be for public health to trace them all down and interrupt chains of transmission to keep the spread of COVID-19 under control. Thank you.
Et finalement, diapositive 17. Le Canada.
Slide 17. Canada has made significant themselves and others. Across the country, jurisdictions continue to increase social and economic activity with appropriate conditions and controls in place to minimize the spread of the virus. Due to the progress that Canadians have made, we will be decreasing the number of media availabilities that we will be holding each week unless there is something we need to urgently bring your attention to. We will also be issuing statements each day to keep you updated on the latest numbers and any news on the days that we are not holding a media availability. The virus has not disappeared, and resurgence can happen at any time and in any place. Until there is a vaccine or an effective treatment, we need to continue to live with COVID-19 by balancing the risks of spread of COVID-19 with the unintended social and health consequences of restrictive public health measures. If you do test positive, consider that the fewer people that you have had contact with, the quicker and easier it will be for public health to trace them all down and interrupt chains of transmission to keep the spread of COVID-19 under control. Thank you.
Thank you. And there are some additional data that we have in the annexes to the slide, which we don't have time to go through all of them, but just an update on some of the ones that you've seen before. So thank you.
Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une ou des deux langues.
You can ask your question in either official language.
Follow up for those asking questions in the room. We ask that you make yourself your way to the freestanding mic. Over to you, operator, Emily.
Thank you. Merci. Please press star 1 on your telephone keypad if you would like to ask a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question, our first question, is from Jordan Press with the Canadian Press. Please go ahead. À vous la parole.
Good afternoon, doctors. Dr. Tam, I'm just curious about actually the first known case of COVID. I believe it was a gentleman who had flown back from China. And I'm curious, did he fully recover? Are we watching him in a scientific way? Were we able to trace any other cases of infection to him? I'm just curious if you can give us an outline of that very first case that has sparked an outbreak, a pandemic in this country.
So I think obviously any details should go to the local or provincial health authorities. As I recall, that particular individual was with a traveling companion or member of the family. I think there was a husband and wife. And but as to what happened exactly to them, I think that is best answered by the local jurisdictions, and we don't sort of discuss those individual details based on privacy and other issues. But I think one point I think you're trying to make perhaps is that there's more and more information that we can learn about what happens to people, not just immediately after they got sick, their journey through their clinical illness, but there are more and more studies that is going to have to be ongoing, I think, to look at any longer term impacts of COVID-19 on individuals. We're still at the sort of beginnings of learning about the impact of the virus.
It's Dr. New here. Maybe just add to what Dr. Tam said. Also, your question, you said that the first case you think, quote, sparked, quote, the epidemic in Canada. I just want to be clear that this was the first case that was, detected, reported in Canada, and subsequent cases that were also reported in Canada had no connection to that first case. So it wasn't that this case then led to further chains of transmission. So I just want to be clear that, obviously there were subsequent cases which were detected sort of independently in Canada, and they weren't all linked to, quote, that first case, as you might have alluded to. Thank you.
Great. That's an important clarification. The initial cases were well managed. They didn't, those very first few cases didn't lead to further transmission that we're aware of.
Thank you, Doctor. A follow-up, Jordan?
Yeah, I just wanted to ask a little bit something else. You mentioned at the end of that we're going to have fewer of these briefings. So can you just maybe talk a bit about then what a typical day?
You cut off, Jordan. Do you want to start your question again?
Oh, I was just kind of wondering, because you mentioned there's going to be fewer of these media availabilities, if Dr. Tam, you can describe a bit what your regular day has been like over the past few weeks, given everything you've been doing, and then maybe what the next few weeks are going to be like for you as you try to maybe recharge for the fall and a potential second wave.
Thank you so much for asking that question. Not many people have really asked me that. I think it is important to recharge. Right now, though, while we're not maybe doing every day during the week press conferences, there is no doubt that we're still working nonstop. A lot of the work that we're doing right now is not just to be extremely vigilant about this current phase of reopening and be able to address any little sparks of outbreaks quickly with the provinces and territories. It is also time to make sure we recharge everything so that we're ready for any resurgences. So recharging all around. But that is very important because I think most of the public health workers and anyone in the health system, I know all of my colleagues have been working extremely hard. And I think on another interview, I was saying that I was probably working about 20 hours a day. That hasn't changed an awful lot right now. So I think I need to sort of take my own advice, perhaps, on people balancing their mental and physical health and trying to do that a bit better myself. Thank you.
Thank you.
This is Dr. New. I just maybe add to what Dr. Tam said. Certainly, Dr. Tam, myself, we're still continuing with regular teleconferences with our counterparts in the Special Advisory Committee, with all the provinces and territories. And what she didn't mention is that she and I have been having active discussions to make sure that she takes some vacation time off, and I sort of cover for her and vice versa, because I do think that it's important that we, celebrate Canada Day coming up, and obviously our wonderful summer here in Canada. Thank you.
Thank you, operator. Next question.
Thank you. Merci. Our next question is from Philippe Vincent Foisy with Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, good afternoon. I have a question regarding immunity. People who are asymptomatic might be immune to COVID-19 or may not be. Is this concerning to you? Because we want to restart the economy. Does it concern you that saying that people who are asymptomatic have very low levels of immunity? Answer. It's Dr. New here. Science is continuing to evolve, and both of us have been closely monitoring what's happening in other countries and here in Canada. We are looking at serologic research. This is a concern. We know that people's immunity doesn't last long if they've been infected. This will have an impact on public health measures, and we need to keep these public measures in place. And it also puts more pressure on us to find treatment and a vaccine. For now, if immunity doesn't last, then this needs to be factored into our approach when we talk about a collective immunity. We're going to continue our research and find other treatment methods and a vaccine. But we also need to remember that the public health measures, such as physical distancing, good personal hygiene, staying home if we're sick. These are all measures that are important to maintain. Follow-up question? Yes. You didn't mention masks, even though you recommend the use of them. A lot of people use them. A lot of people don't. We walk around a grocery store. We walk throughout the city. We go to different businesses, and there are still a lot of people who aren't wearing masks, who may find it useless. Is it concerning to you that a lot of people are not wearing masks? Are you going to make the wearing of masks mandatory in the coming months because it's an effective way to fight COVID-19 and it might slow a second wave? Answer: it's Dr. New again here. Perhaps Dr. Tam will have something to add afterwards. We know that wearing a mask, a face covering, is an additional measure that is important. It's also important, of course, to maintain the other measures such as physical distancing. This is something that we have always highlighted. If it's not always possible to maintain physical distancing if we have to take public transit, for example, or if we have to go to the grocery store. I believe that it's better to raise awareness. It's better to educate people so that they understand that it's a good habit to take. It's something that can be used for people to protect themselves and to protect others. I think that is more effective. It's more effective to encourage people to use them. We need to educate them instead of regulating. This is a measure that provinces and municipalities can consider. Certain municipalities have already put in place something more regulated measures, but I think that it's better if it's something that people can choose to do. If people realize that it's good for them and for others, I think they'll be more likely to do it. Dr. Tam?
Said a reminder to Canadians that this virus hasn't disappeared. I think another fact that became more, if we don't know the extent to which asymptomatic people can transmit, there are studies show that they can. So with that in mind, as we go about leaving our homes and going outside in a safer manner to protect yourself and others, we recommend wearing a mask if you can't keep the physical distancing. And you can imagine a lot of these places are, as you said, the grocery stores or the public transport, etc. I think, it is actually quite difficult to tell if the virus is still in your community, which I think is a general recommendation. But listening to your local public health as to what activity is there. But it's actually maybe much easier for Canadians just to remember, if you can't keep the 2-meter distance, remember that mask to protect yourself and others. So I know it's not easy to do, but I think it's a really important added layer of protection on top of the physical distancing, the hand hygiene, etc. One other message is that what we just said in the modeling presentation, try to keep the number of your contacts low, makes it easier, reduces your risk, but makes it easier also for public health to immediately do your contact tracing, that type of thing as well, at the same time as public health is increasing their capacity to do the rapid case detection and contact tracing. And the mask is just another added layer of protection. Don't forget the rest.
Thank you, doctors. Opérateur, prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Benjamin Vachet with TFO. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, good afternoon. Regarding the data you shared today, it seems as though a second wave is inevitable. Is this what we need to remember from your presentation today? Answer. Thank you for your question. It's Dr. New here. With modeling, we've stated that this isn't a crystal ball. There may be a second wave, but when will this happen? People are saying that it could happen in the fall. We know today that if Canadians throughout the country set aside all public health measures, physical distancing, wearing masks, good health practices, well then, there could be another wave in 2-3 weeks. But if we maintain our public health practices, well, experts believe that in the fall, it will be colder, and with flu season and cold season coming up then, it might be important to plan for different outbreaks of other respiratory viruses on top of COVID-19. So we have to plan for this. But it's important to maintain the public health measures that are in place. I would like to add something as well. On slide 12, as Dr. New said, it's a simulation, it's a model.
With that resurgence, which by the way can happen anytime if you let go of things, is actually happening in real time in some parts of the world. That is what's going on. That is not a simulation. You're seeing that resurgence in places where some of these measures are not adhered to. And so that's why that's the message that we're trying to provide.
Merci. Question de suivi?
Follow-up question? Does this mean the interpreter regrets, but the beginning of the question was inaudible? Do you believe that governments are going too quickly in loosening measures? Answer. It's a good question. The reality with epidemiology is that things are different in the different provinces and territories in Canada. At the provincial and local levels, it's important to understand what the realities are. For the loosening of measures, for activities involving 20 people, for example, public health authorities throughout the country are recommending a lot of caution. And if we continue loosening these measures, it's important to have the capacity at the local level to rapidly detect cases, and labs' capacities also need to be able to react quickly. This is something that we mentioned in our presentation. We need to be able to rapidly detect cases. We need to isolate them and do the contact tracing quickly as well. This is very important. We'll see what's going to happen in the different regions in the country.
Schliberg, CBC News.
Good afternoon. Dr. Tam, given all of the, I guess, evidence, mostly observational, that's mounting around masks, why have you, when it comes to masks, have you decided if you, What's the main reason for not mandating masks in certain areas, including stores and public transit, and what are your concerns?
So we recommend mask wearing, non-medical mask, facial covering, if you can't maintain the 2-meter distance. Where there are variations is that with all the chief medical officers of health, they would like the flexibility depending on the virus activity in their jurisdiction to provide those recommendations locally. So you've seen some local medical officers of health who knows their population and what they're up to and what activity they've been seeing, essentially adjusting their policies accordingly. I do think that empowering Canadians, getting to understand why it's important, is the absolute foundation. We want people to buy into this measure. But under certain circumstances, maybe with outbreaks and other situations, or transmissions not getting controlled, some local jurisdictions going one step further. But I would like to, I think that based on some of the public opinion research, the proportion of Canadians wearing masks in those settings are increasing. We want it to keep increasing, and we want Canadians to want to do this to protect themselves and others.
It's Dr. You maybe just add to what Dr. Tam said. I think I answered a bit in French, is that certainly in terms of the mask, Dr. Tam and I and others, I think, across the country have been very clear that it's recommended. It's a very good additional measure to protect yourself and others, certainly when you can't keep that 2-meter distance. But it also comes down to, I'm not an expert, I would think also social behavioral science. It's much better to have an empowered, educated, if you can call it, population that understands the utility, the usefulness, the effectiveness of using masks than right away going to what you might call the regulatory approach. And some people, it might even, as they say, get their backs up. And if you made it sort of mandatory right off the bat, some people, based on how they think and believe, they might actually resist that. So I think, from a public health perspective, the bottom line is we want as many people as possible to be wearing masks. And what is the best approach? It might be a range of different tools. And certainly the regulatory approach is one of those tools. But certainly I think most public health experts would agree that's probably the sort of tool of last resort, if hopefully we can make all the other tools work.
As some airlines are going to be blocking the middle seats come July 1st, they have other safety protocols in place. For example, the mandatory mask wearing, air filtration systems, they're doing temperature checks. They say that those will keep people safe. What does the science show? Is it safe to sit elbow to elbow next to someone for hours on end during this pandemic?
So I think I certainly acknowledge the concerns of the general public who probably purchased a ticket thinking that there'll be a sort of seat next to them that's sort of empty, and this is a bit of a sort of unexpected, or maybe news that's just sort of suddenly come out. I do know that from a public health perspective, we're recommending the physical distancing, the 2 meters, and if that cannot be done under certain circumstances, absolutely stick to all the other measures like the hand hygiene and wearing a mask. Wearing a mask is actually required by Transport Canada. And as you said, I think the international transportation community is looking at many layers of measures. But I do think that Canadians need to make some careful decisions. Before traveling anywhere, you sort of need to take into account your own personal health conditions, and all the way through the really the travel experience. There are different routes from the time you leave your house, maybe to get a bus to get to the airport, etc., or along the way. I think looking at how one can protect ourselves and reduce the risk, I think, is really important. But certainly from a public health perspective, we believe that physical distancing is an important part of the measure. And if where it's not possible, wearing a medical mask and all the other measures would reduce spread.
Thank you. Next question, CTV News.
Hi, doctors. Mackenzie Gray from CTV. Following up on Ashley's question about planes, do you think it's right that the airlines are making the middle seat now sold? Up until this point, people have been skittish to fly, and it's been your recommendation that they shouldn't be traveling unless they absolutely have to. I think this would make it a little more difficult. And for both of you doctors, would you feel comfortable being on a plane right now in the middle seat with the aisle full?
So, yeah, I think there are some sort of difficult decisions and for travelers for sure. And I think making sure that we all, as I say, understand our own individual risks for COVID-19. We in public health, together with the chief medical officers, recommend some very careful thinking before you travel. We're still recommending right now avoid non-essential travel to other countries. Within Canada, medical officers are recommending, in general, stay closer to home and, travel. If you're going to have a vacation, make sure you do that in a safer way as possible, which includes staying closer to home. But I do recognize that, provinces, for example, having managed the cases, opening bubbles, where they're trying to increase the safety of those transportation and experiences. But again, as I said, from a public health perspective, keeping the physical distance is important. And if for whatever reason that is not possible, wearing the non-medical masks. I think airlines where it is possible for spacing to occur, try really hard to do that. And maybe for certain individuals, such as those who might have underlying medical conditions, if they absolutely had to travel, maybe take that into consideration as well as they start doing seat assignments. I can't really speak too much for how the industry can actually make that happen. But I do think also explaining to travelers quite carefully about each of those procedures that they have put in place to try and make their travel journey safer. But I think, as representing public health advice, we really feel it is important to avoid the close physical contact as much as possible. And if not, wear the medical mask. And hand hygiene is actually really important in this context as well.
Yeah, it's Dr. Maybe just add to that. I think what your question is getting at is really the issue of both risk management and risk tolerance, and the fact is that you can do it at the population level, but it's also an individual choice, When you leave your house in the morning, you're assuming all sorts of risks. You never know. You might get hit by a bus or, who knows what might happen. So in this context, certainly what Dr. Tam and I have outlined is that from a public health perspective, the physical distancing is certainly one of the key public health measures. And then we've also talked about the face mask, that's something that can also use if it's impossible or difficult to maintain that 2-meter distance. I would say that certainly for individuals who probably are at higher risk of, let's say, more severe consequences. If, let's say, you're a senior or you have underlying medical conditions, I think you need to, in a sense, make your own sort of risk assessment in terms of what's the risk benefit in terms of you were to go traveling, and this was, quote, maybe the only mode of transportation you could be using, taking a flight. Other than that, I think all of the other measures the airline industry has put into place, I think, the temperature checks, the mandating of the masks and so on are fine. I can't really get into too many of the other thinking and details in terms of the middle seat. If really that's the way it's going, Dr. Tam and I are quite clear that the physical distancing is probably, I think, our recommendation. But if, for example, let's say there were two people that were to sit close together, then I would think that maybe one thing to think about, or maybe who knows, that's part of the planning, is that if there were, let's say, a family or a couple going together, then maybe if they're already in their own bubble and they were flying together, then of course, if someone had the the window seat and then the middle seat and so on, then that might be something that might be quite an acceptable risk for those people already in that bubble.
On the issue of vaccines, in the U.S., Dr. Fauci said that, and this is a quote, "It's when, not if, there will be a vaccine." And he says that he's cautiously optimistic that there'll be a vaccine by the end of 2020. Is that your assessment of how the vaccine process is going so far?
Well, I think there's definitely an unprecedented amount of international research going on. I think that being cautiously optimistic is not unreasonable. But given all the uncertainties right now, we need to prepare for a scenario where we won't have vaccine for a while, so which is what we are trying to do as well.
Thank you. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Merci.
This concludes today's press conference. Thank you.